So the only rule we have statewide with respect to K through 12 education is that there's an 80% threshold. And if a school building or a school district can get over that 80% vaccinated threshold, they can make their own call with respect to whether or not they want to have masks. This January 15th date is designed specifically to give a lot of schools and school districts the opportunity to either continue to get kids vaccinated who are already eligible to get to that 80% threshold, or some of the adults as well, and to now have an opportunity to get kids from the age of 5 to the age of 11 vaccinated as well. But from our point of view, the big thing here is vaccinations work. They've been proven to be safe and effective. They've had a huge impact on hospitalizations, case rates, and sort of almost everything associated with life as we know it here in Massachusetts. And the only standard we have at the state level is if you can get to 80% in your building among staff, teachers, and students, you can make the decision about whether or not you want to remove masks. But you can't do that until you're eligible to get vaccinated. And that's part of why we're so excited about having the vaccine available for kids between the ages of 5 and 11.
In regards to booking vaccination appointments on the Vaccinating website, is there an option for parents who are looking to vaccinate multiple children at the same time? We've been hearing from some parents that getting appointments booked, you know, if you have 2, 3 kids, could be difficult if they have to get them done at different times.
Do you know the answer to that one, Commissioner? Let me get back. I think I know the answer, but I want to make sure I get it right. So can we get back to you on that one, Aaron?
The website is live for appointments
Yeah.
right now.
Yes.
And our vaccines actually going to ours today.
Yeah. Yeah.
Governor, so we heard from some parents who were just eager to get shots into their children right away after the federal government's approval, and they were disappointed yesterday to see that, you know, in some other states kids were getting them Tuesday night and they couldn't get appointments. You know, there's a delay even if just a few days here. Why is that?
Well, we have places that are available to get appointments now. And if someone tries to get an appointment today, they will be able to do so at a number of locations around the Commonwealth. My only comment, without knowing the absolute specifics of the question you're asking, is to say that there are 500 sites around Massachusetts that have signed up to participate, and that the vaccines have been delivered by the federal government, and they will be rolled out. And if somebody wants to get an appointment today, they should be able to do that. If they can't get an appointment for today, they can certainly get one for tomorrow or the day after. And as I said before, they can call 211 as well if they're having trouble accessing an appointment through the website. But they should always call their pediatrician to start. And we've said that also from the beginning.
Good to see you again. There's a
Long time no see, John.
Long time
Yeah.
no see. We're back at it. There's a significant percentage of parents that don't want to take a risk with their little kid. Can you understand that a third of the parents feel that way, and I'm sure the doctors are trying to get the message across, but the reluctance is out there.
So I think that was a national study. I don't think we know what the numbers would be here in Massachusetts. I guess I'd say the following, and I would want the doctor to speak to this one as well. The one thing that is pretty clear about vaccinations generally and COVID is states that have high vaccination rates have low case counts, low hospitalization rates, lower rates of death. That data at this point is virtually undeniable. And we also have here in Massachusetts, as the commissioner said and as I said, about 80% of the kids between the ages of 12 and 17 who've gotten vaccinated already under the program that we have in place, which we think is terrific. We test kids in school every week in Massachusetts. We're one of the few states in the country that runs a program that's available to pretty much any school that wants to play. And we have 2,000 schools that are part of that pooled testing program that we run every week. And the positive test rate in that pooled testing program is less than 1%. And I think part of that is driven by the fact that we do have a lot of kids in Massachusetts and a lot of staff and teachers who are already vaccinated, as well as a lot of adults who are vaccinated as well. At one point in August, there were 9,000 kids under the age of 17 in Florida who tested positive for COVID. At that point in time, there were 250 in Massachusetts. And that, in my opinion, was a function of vaccination rates. So I can't emphasize strongly enough the relationship, which is just borne out now across all the data, that vaccinations absolutely reduce the risk of getting COVID, the risk of being hospitalized. And that is very much true at this point for every age group that's been involved in this process. Parents should absolutely talk to their pediatricians. They should talk to their family doctors. They should talk to their primary care providers. And I certainly have understood from the beginning of this, and we talked about this last January, that I understood why some people were nervous about this at the start of the process. But over time, as more and more people have been vaccinated, and more people have had the opportunity to think about it and to make their decision, we've continued to see increasing vaccinations here in Massachusetts. I mean, we still have some communities that are adding newly vaccinated people to their population every single month. And many of them are communities that were relatively slow to move early on in the process. Take Chelsea, for example. I mean, Chelsea's basically to the point now where almost 100% of everybody who's eligible is vaccinated. So I think the vaccines are proving themselves over time, but people should talk to their child's doctor and to their own doctors, and then make the decision based on that information. But I certainly hope, based on all the data that I've seen, that they'll decide to get their kids vaccinated, because I do believe that's the safest thing for them and for their children. But I would really like Dr. Polanco to speak to this.
Thank you. Yeah, I will say that that has been my experience from the beginning. A lot of parents who have questions, and I think it's very normal to have questions. And I invite the pediatricians that if the parents don't have questions but are not taking the step to vaccinate their children, to bring it up and talk to them and to discuss what are the barriers for them. Because as a mom of 2 children who are going to turn 2 tomorrow, I can't wait for that, to hear the news that the vaccine is available to them as well, to protect them. So I share my personal experience with them. When I got my vaccine, I share my experience with other patients and how they're doing, but we have to focus on answering their questions. And so they feel comfortable when they take the step to get them vaccinated.
Governor, you said earlier that 8% of kids ages 12 to 17 got one dose. I'm trying to clarification. Mark Cook said 12, ages 12 to 15. Just which one?
Mine was, I'm going to check, but I'm pretty sure mine was 12. Yeah, mine was 12 to 17. One of the issues with the data generally is the way it gets broken up into 12 to 15 and then 16 to 18. And we then have to sort through it to come up with the slices and dices. And there'll be a little variation on the margin there, but it's pretty fair to say that somewhere between 7.5 and 8 of every 10 teenagers in Massachusetts have had at least one dose, and probably close to 7 out of 10 are fully vaccinated.
My other question was, how many doses have we received from the shipments already started?
Yeah.
What do we have for pediatric on hand?
I think 380,000.
Last question.
But again, I don't expect there's going to be a shortage with respect to that going forward.
Governor, what's your administration's plan for meeting the 2016 clean energy law going forward in the wake of the main ballot question's approval on Tuesday?
So, first of all, we're discussing this with both the folks at Avangrid and some of the folks on our own team as well to determine what the next move here might be. But I think the decision in Maine, to some extent, speaks to a much larger issue, which I've talked about before, with regard to the work that is being done and will need to be done to electrify those parts of our economy that are currently driven by fossil fuels, and that is transmission capacity and the strength and power of the grid, whether you're talking about wind or you're talking about hydro or you're talking about basically any other form of renewable energy. Transmission has got to be a big part of the discussion, because we're talking about literally in some cases doubling or tripling the amount of energy, electricity that's going to need to be available to do it. This is a challenge not just for us here in Massachusetts, it's a national challenge. It's why Secretary Granholm came out so aggressively for that project before the election, but we're obviously looking at the results and talking to Avangrid, and they and we will figure out what the next move is.
Do you feel that the New England Clean Energy Connect project is effectively dead at this point, or do
No.
you still see a path forward?
No, I don't. I don't see it as dead.
So can you give us an idea of how many appointments are being booked so far among the 5 to 11-year-old age group?
I can get back to you on that one. That number changes like every few minutes.
Of course, yeah. And then President Biden announced a January 4th deadline for big businesses to vax up in the workplace or mask up basically. Are there going to be any resources available in terms of getting those testing kits to Massachusetts businesses, and is the state going to play a role in that?
So there are two questions associated with the testing kits. The first is the feds have gotten a lot more, in my opinion, serious and aggressive about appreciating the value and the importance of rapid tests. We've done many things in this country very well from the beginning of the pandemic. Other countries, I think, did a better job of getting ahead of us on very cheap, very accurate rapid tests. I mean, they're everywhere in Europe, and they cost $1. And I do believe there will be significant resources available this fall. And when I say resources here, I mean test kits, cheap ones, different kinds of ones that we've had available historically. Not just for employers, but for families and sort of everybody, to put a much bigger and broader emphasis on the importance and the value and the utility of rapid tests. They've gotten a lot more accurate. They've been proven in Europe and in the US to be enormously effective at helping people deal with this question about, do I have COVID every single day? And I'm looking forward to having a much bigger collection of choices and options for people associated with those test kits shortly.